So, welcome to Dr. Sally Moorcroft. It's so lovely to have you on this call, and it's just wonderful that you're going to be able to talk to us about herbs, your interest in them, herbal medicine and herbal teas. So welcome, Sally, first of all.
Thank you. Thanks for having me.
As an introduction, Sally is a doctor. She does integrative medicine and has an interest also in women's health and has won awards for her work. So, Sally, over to you. Just tell us a little bit about yourself.
Oh, hi. Thanks for asking me to come in and talk to your group. So I've been doing integrated medicine for, it's nearly about 20 years now. And I think I was first interested in it way back before I went to medical school, actually, when I worked in France for a year, and I just saw the kind of European model and how healthcare worked in France and Germany, and there was a more integrated system in terms of herbal medicine and also homeopathy. And it just happened that the family that I lived with as a nanny had this kind of approach to healthcare. So it was my first introduction, really. Went off to medical school and just did my conventional training. I always sort of thought I would just go into doing GP, really. But as I came through the training, I actually just developed an interest myself in, mainly through traveling as well. I went to India for my elective and I started having a look at Ayurvedic medicine. I had started looking into sort of acupuncture and then had some health problems myself. And so basically for that, I actually used some acupuncture and it helped. So I just sort of started to develop an interest. And I'd also had a long interest in nutrition from being very young. Just my family, really, we're a very foodie family. So I was always very interested in food, growing food. I had an allotment. I was just, so I think it was very natural that I became quite interested in plants. And I thought, is there something in this? Obviously, there's a traditional use. And I was quite cynical, to be honest, when I first started. I wasn't really quite sure how effective they would be. Maybe it was something that could be used for minor problems, but I wasn't really sure how effective they could be in more complex conditions. But I thought I would just do it as a kind of a side interest initially. And so I did, I started doing the studying, and then actually part of the study I had to do was there's a herbal medicine clinic at the Archway Hospital in North London. And so I did a lot of my clinic hours. So I decided to do basically a herbal medicine degree. And part of that was we did 500 hours in different clinics. Some of the hours I spent in this clinic in London, and the herbalist that I studied with there, called Hernanya, was very closely working with the gynecology department. So we were getting a lot of referrals from gynae for women who really would, basically going for hysterectomy or going through menopause, endometriosis, polycystic ovaries, just sort of conventional, normal things you would see in gynae. And the results that they were getting in the herbal medicine clinic was actually just completely, it blew me away, actually. I had no idea it could be that effective. And I think that was the real turning point when I thought, wow, there's something in this. I really need to study. And it really just grabbed my interest because I just saw how effective it could be. So that's kind of why I went off in that line.
Mm-hmm. And tell me, so you've got this big interest, and you've seen it work. What would be, you say, how many women do you think are perhaps missing out from this? Would you like to see more of this in the UK, or do you think that to have a specialist clinic is the better way, or do you think that actually, herbal medicine should be a much more part of our vocabulary?
I wish it. I do think it's wasted resource, in honesty, just from the results I've had in clinic. And I know that the lack of really robust evidence in some areas is what holds it back. And there are moves towards trying to address that. I think it's always going to be limited. It's hard to get big trials to support to support its use. And I mean, I know obviously in Germany there's a lot more money going into research there, and that's where a lot of the bigger trials come from. And here there's been some nice pilot trials. For example, the National Institute of Medical Herbalist did a nice pilot trial in menopause, which was really positive. But it's all still quite small pockets of evidence. But I think,
can you tell us any more about that trial? What exactly they did?
So they were just measuring, but I can actually send you a link. That might be nice to too, because it was quite positive. What they did was they, I can't remember exactly how many herbalists were involved, but they did it as though you were treating in practice. So they were given a range of herbs that they could use. They were adapted through the treatment process, so the patient was seen, and as the treatment went on, you adapt the you adapt the prescription, so it's not a sort of one size fits all approach. It would be very much tailored to the individual. So it was very much as though as you do in practice. So, and I think that's the challenge with herbs, is as a practitioner you tend to use quite a complex prescription. So you might use 5 or 6 herbs. It wouldn't just be going and using some black cohosh off the shelf, for example. You're much more likely to blend a prescription and to suit it towards that individual. So what was nice about this trial was really showing that in practice, and they were just measuring sort of standard hot flushes, sleep, libido, mood, energy, but all positive. I think, as far as I can remember, they were all positive, particularly the flushes and the libido from my memory. But I can send you the link because it's
that'd be helpful. I think that'd be helpful. It'd be helpful for some of the women in the group. So my sort of background is from Germany. I was working as a gynecologist in Germany, and we could prescribe herbal prescriptions. There were things that we could prescribe for breast tenderness and things, but we tended to prescribe one individual, if you like, medicine or herb. And I've always felt personally that prescribing one ingredient or one component, and I've also said this to women, buying multi herbal things, you didn't really know which one was working. So how do you work that out? Because I'm a sort of bit of a purist. Okay, if you want to try one herb, you try this one and see what happens. If you want to try another. So am I wrong in that, or is there, what's your view on that?
I mean, there's different traditions. If you look at different traditional herbal medicine theories, and there are some people who do have that kind of purist, what we call like a simple, where you use one herb on its own. And for example, Agnus castus, Vitex, is very good on its own, and so I would use that on its own for PMT and for regulating cycles. That's a really nice herb that's just very effective on its own. Some herbs, and black cohosh is similar, that's a good one to use on its own as well. Some herbs, particularly if you look at the sort of TCM approach, when you're making a prescription up, you're using what we call like active kind of leading herbs and then supporting herbs. So what you might do is have one which is got more sort of pharmacological action, and then you have other supporting herbs which maybe are more sort of nourishing. So particularly in women's health, you often use blood tonics, for example, like Chinese angelica or peony, which are very supportive and nourishing. I see them almost as food. They're very almost like a superfood. So
in what way do they work? Do they increase your hemoglobin, or how does that work?
So that is basically, some of them can do. So ashwagandha is another one, which is a tonic that does help. Can boost white blood cells, for example. So there is some studies on that. Sometimes they also regulate the HPA axis. So that's another way that they work, which is by modulating the stress axis. And that's what I often use them for, because then you may have some herbs more directly hormonal and some herbs which are supporting or modulating the HPA axis, which is
just explain the HPA axis for people that don't know.
So the HPA axis is really it's sort of the hormonal kind of pathway that regulates stress in the body. And for women, often hormonal issues, I find particularly, are driven by stress. And so you're looking at really ways of managing stress. So you would be looking at maybe lifestyle as well. So maybe doing some mindfulness or exercise, or improving sleep, or having time out, for example. So all of that's important. But I find the herbs, particularly things like ashwagandha, can be very helpful for regulating, and they help to reduce cortisol in the body and regulate this axis, which basically just takes the load off the body when it's under stress. So I find them particularly helpful for women where you're in a stressful environment, it's quite difficult to get away from it. You're trying to do things, but I find for a lot of women in my clinic, it's a period of life where you're juggling an awful lot, and sometimes it's quite hard to know which area can give. You know, you've got responsibilities in many areas, and even with the best will in the world, you are limited with what you can do. So I find them helpful for supporting the body when it's going through a lot, basically, as you would do with food. I see them very much as kind of sort of building foundations of health, really.
Yeah. And I think it's, I mean, obviously traditionally there have been a lot of herbs abused, and it's important, I think, for us to emphasize how potent a lot of these herbs can be. That they're not just sort of, you know, leaves that you pick in a garden and have no working. They can be potent ingredients in them. Yeah.
And there's spectrum. There's some which are like food, you know, that you kind of can use, like your culinary herbs, which are maybe milder, like chamomile, or, you know, things that you might just grow in the garden, say chamomile, for example. Lemon balm, that's another nice one. They're quite gentle. They're, you know, they do have medicinal effect, but they're, you know, they're on the more gentle side, I would say. And then obviously, if you think about, you're going right through to very strong herbs, which some of those, you know, we isolate components from for drugs, and you know, particularly herbs with alkaloids in, they are the strongest ones, and they will be the ones that tend to be maybe neurotoxic or dangerous or poisonous. So, you know, you're going right up to that spectrum. And obviously some of the most poisonous plants we have, you know, are very toxic. So there is a spectrum. And you know, I suppose in terms of people using things at home, in terms of herbal teas and things you can use in your cooking and in the kitchen, obviously you're going to stay down, you know, with the more gentle ones. You need to really see a practitioner if you're thinking of using. You know, I would definitely recommend seeing somebody if you're thinking of using the stronger herbs, because you've got interactions with drugs perhaps that you may need to consider. You might be, you know, certainly needs a tailored approach, because people have a lot of maybe other medical health problems. You know, there's a lot of things to consider.
Yeah, thank you for that, because I do think that that is an important message also, that it's not just sort of playing around. It's actually a serious business, and there can be serious health issues if they're not used properly or prescribed properly or under some sort of care. And again, I think we've got a little bit better of it as doctors now, but and perhaps as patients, that certainly at one stage there was almost a little bit of a I don't want to say shame or deception, but those words perhaps come in, of patients not wanting to tell their doctor what they were also taking, and doctors not wanting to ask. And we need to have a dialogue. You know, whatever your doctor's views are, I think you do need to be telling your doctor what you're taking, and equally for a doctor to ask, are you taking anything over the counter or with other practitioners? I think that's
I think that's sort of education, isn't it? And I think, you know, I mean, I'm involved. There's also the National Centre of Integrated Medicine in the UK in Bristol. I teach there as a tutor, and we are seeing, you know, they run a lovely diploma in integrated medicine for GPs and for nurse practitioners, and that's just growing. I think I've also done some teaching in medical schools, you know, but it's still very small amounts. So I think it's often just the fact that people don't really know much about it, and it's not something part of mainstream medical training yet.
No, not in the UK, perhaps in Germany, but not in the UK. So my other question really, or another question I just wanted to talk with you. So when, as women, I have a little bit of some views on this sort of thing, that we go through these vulnerable stages. So you know, we go through a vulnerable stage when we perhaps have got difficulties getting pregnant. And that is a sort of vulnerable stage when we can be equally pressurized to try anything and everything. We perhaps have it again if you have just given birth, and there's all sorts of things around there. They may be marketing towards the baby, but you can be buying and spending unnecessary money there. And then again at the menopause time, you know, we are targeted or for things, you know, do they work, don't they work, what do I need? And of course, when you're wanting something to be settled, we are naturally and ever, you know, wanting to grasp at straws or grasp at things. So what do you think about the vulnerability of women to being sold herbal products that perhaps, you know, they're not necessary? Or do you have a feeling on the vulnerability of women really and how they're marketed to?
Yeah, I think there's two things. I think probably there's one which is about, you know, the overload of advice that is now available that people source, and that there's a lot of people claiming to be experts or giving opinions and advice who maybe don't have really much sort of experience, or which is a complete minefield in itself. And then there's the supplement industry, which I think is also an issue in terms of quality. And, you know, the issue I see a lot is people coming with a carrier bag full of supplements, for example, and you know, I'm sort of kind of going through them, and you're really, you know, some of them maybe are good quality and helpful, but there's also a lot which could be very poor quality, that, you know, there's not an awful lot of regulation in terms of what's available, you know, what is on the market now. So I think knowing that, you know, you need to look for good quality products, and usually the reputable supplement companies and providers will be quite good, you know, are more what's the word, you know, they're more tailored in their what they're advising anyway, that, you know, they're not doing the hard sell, because they're so I would also always look for good manufacturing practice if people are buying supplements, because that guarantees that there's traceability, that it's what it says it should be on the packet, that it's you know, it's been, say if it's a herb, that it's been harvested and stored correctly, that it's had some sort of traceability and testing for adulterants. I mean, you can also have issues with things being mixed with you know, heavy metals, for example, or, you know, from fish oils, you can get them contaminated with you know, PCBs and problems with from fish sources as well. So there are huge issues in quality, and I think it's, for everybody, just needs to be careful with taking advice. I think women, but also men as well. I think it is just a minefield out there at the moment. I mean, I think you're always better, if possible, to try and seek expert advice from someone who's qualified, because, you know, looking on the internet and Googling, it's, you know, it can take you down so many rabbit holes. I see it not just with women's health, but I see it with people with chronic, you know, cancer as well, because I do work with cancer patients a lot, and they're another very, very vulnerable group that, you know, that they often will Google, bring me this diet that they're doing, that they've seen somebody talking about online, that's really extreme, or, you know, that, or they've got this book that they're doing this extreme program, you know, and there's just, I think it's just all of the whole area now, it's riddled with you know, rabbit holes that people can go down.
Yeah. Okay. And so our best way to stop that is to look for that quality of the product.
In terms of supplements, look, I mean, I was sort of listing the supplement companies I use are Wild Nutrition, that's very reputable. It's set up and run by a qualified, very highly qualified nutritionist, and she's very good. So Wild Nutrition, In Vivo, a very good brand as well, and all their information is also very reputable. They work with Tim Spector in King's College, and the work that they're doing on the gut microbiome, they're very reputable, and they have a lot of information on their website as well. And BioCare, they've been around a long time, very good company, also do some educational material, and have resources on their website, and Cytoplan, which are very nice for sort of general multivitamins, and they have food state vitamins, which are sort of the most like food that you can get, which makes them very absorbable for people. So they tend to be quite low in dose, but very absorbable and in a food state. So they're often a nice one. So all of those four I use, and are very reputable and have information on their website, which I would say would be useful. Otherwise, I mean, you can look at, you know, I think otherwise you are better just looking for somebody with qualifications, who you can even if it's just a one-off. I mean, I sometimes, if people on a budget, just to have a one-off session with somebody who will go through your supplements and see, are they right for you? Are they correct with any medication you're taking? You know, do you need to be taking all of them, or can you actually do it with food and lifestyle, and just get you on a sort of a core foundation, maybe a multivitamin and some fish oils, vitamin D, for example, just basics. And then you know, then you don't need to get involved. I mean, I see that with people just coming sort of almost as a checkup, just, are these okay? And then that's it. You know, I don't really have to continue to work with them, but I think just as a one-off to make sure you're safe.
No, that's great. And how do we find someone to do a one-up check? How would you find somebody? If you know, if say you've got, you know, maybe a general practitioner who's very busy, overworked, maybe, you know, they want to send you somewhere. How would we find you?
So I think I would say, if you're looking for nutritional supplements, or then a registered nutritionist, so somebody registered with BANT, but that's the, you know, they're very good at doing sort of an overview of diet and reviewing supplements and just saying, you know, are they safe? They will know red flags and interactions, and that's kind of what you're checking for with that. For herbal medicine, I would say see a qualified herbalist. So then you've got two main regulatory bodies. There's the National Institute of Medical Herbalists, and then the College of Phytotherapy. So both of those, it's a, you know, to be registered with them, you need to have completed a degree in herbal medicine, which is actually very, you know, it's thorough and would definitely cover red flags and safety and interactions. So
thank you, that's really helpful. Thank you, Sally. Great. Now, you mentioned Tim Spector and the gut and food, and I know you've got an interest in that. So tell us a little bit about your thoughts on microbiome.
Yeah, I don't know. I've just been fascinated. I think for the last 10 years, I suppose as a herb, you know, doing my herbal medicine training, you do get drummed into like digestion, you know, like your whole kind of training is focused around digestion, and is somebody digesting their food properly? Are you absorbing your nutrients? You know, you get a bit obsessed with bowel movements. But so from that, I've obviously carried on being interested, and I think it's just the last 10 years. I started sort of going to lectures maybe about 10 years ago. It was just starting to trickle through how important it was, and looking at the developing research, and you know how it's now, you know, there's all these potential links with sort of more chronic conditions, with autoimmunity, with more neurodegenerative problems like Parkinson's, and particularly I think with mood as well, you know, depression, and the fact that in our gut, we, you know, we actually, a lot of the serotonin which influences our mood is in our gut, which I just think is fascinating, you know, when we start to look at that. And so I think I certainly see that a lot of women I see with endometriosis, for example, with chronic health problems like chronic fatigue, you know, when I start to do analysis, you will find underlying gut microbiome problems, you know, and that is very, very common now. And I almost just assume that that's there when I see a particular picture. So, and, you know, I think often menopause is like the camel that, you know, the final straw, really. You know, you'll see women who've got actually other underlying health problems, and then menopause comes along, and then, you know, actually that just, it just becomes overload. And, you know, whether there's, and then particularly fatigue, for example, which can become absolutely overwhelming, or depression, or sleep problems, which suddenly becomes such a huge problem with quality of life. You'll often look back and see a history, and I often find people have had a history of either lots of antibiotics, maybe through their 20s for different issues, plus maybe lots of stress, or plus maybe food poisoning, salmonella infection. You know, there's something else which has happened, and you'll just often see this history, and then a period of often, you know, getting a bit run down, or poor diet, for example, if someone's eating a lot of sugar and not being able to eat well, and then you'll suddenly and then the problems start with either endometriosis, like chronic fatigue, or you just see worsening hormonal imbalance in
Yeah.
other areas.
So am I hearing this correctly, that something like endometriosis, you're seeing that there's a component, I'm not saying for everybody, but for a component that could be coming because of problems in your gut?
I do see that as a pattern. Yeah, I wouldn't like to say it's a causative pattern, but I definitely see this very commonly when you start to investigate, because there's so often IBS symptoms, and you start to kind of go down that route of maybe investigating or testing, and then obviously with the history as well, asking lots of questions. And then when you start to address those the gut problems, you definitely see things improving in other areas.
Endometriosis and irritable bowel syndrome, those two things, some of these illnesses have been weighing heavily on the health service, and probably on us as health professionals, as well. We don't really fully understand them. We don't really know how to move on from them. So with irritable bowel syndrome and bloating, what's your feeling about that? I was going to say, what's your gut feeling about what's behind it? What with all your knowledge and your training, what and your experience, what do you sort of think of?
Yeah, I mean, I think with IBS, from all the studying I've done, you see that they say about 80% of IBS is due to SIBO, which is like small intestinal bowel overgrowth, where basically you're getting bacterial overgrowth in the small intestine that shouldn't really be there. And there are certain bacteria particularly that create gas, and there's one in particular called methanobrevi, which is a methane producing bacteria that I see very commonly that's associated with IBS symptoms. And that's so you often see these kind of more pathogenic bacteria which basically causing gas, and some of those feed on fermentable carbohydrates, which is why the sort of low FODMAPs diet can be helpful, and that's obviously very useful intervention to look at doing that. So limiting foods that are very fermentable can help, and so you can look at doing work with diet that can certainly help. And if people have got very severe symptoms, then I might look at trying to eradicate, you can look at sort of eradicating some of these pathogenic bacteria, really. I mean, that's really sort of a treatment of SIBO, which I do see quite a lot.
What would your remedy be for that then? What would you actually?
So there's two sort of main treatment options. One of them, the sort of low FODMAPs diet, is the first one, which is you need to do that with a nutritionist or a dietitian, really, because it's very strict, and you have to be quite careful when you're doing it, because you do have to restrict down, and it needs to be carefully managed. So you do that initially. Sometimes that's enough on its own, depending on how severe the symptoms are, and then you've got two options. So depending on how you kind of go, actually in studies both options are relatively similarly effective. But if you went through sort of an NHS treatment, so there are some centres that treat SIBO. We've actually got one in Hull, which is they're a sort of specialist centre, and there's Nottingham. There was a professor in Nottingham who had a SIBO centre as well. But I think it's with COVID, I think both of them are a bit. I haven't had any referrals go through, because I have been referring people there, but they're not taking them at the moment. So it's a reduced service. But so if you go down the NHS route, they tend to treat it with antibiotics. So there is a couple of antibiotics which are very specific for the gut and do eradicate these methane producing bacteria. Or what I tend to use in practice, and with a sort of a functional medicine approach, you tend to use more of the herbal antimicrobials. So I often use berberine, which is a sort of strong antimicrobial, and then a combination of either high dose oregano or garlic, which is a medicinal grade garlic oil, or neem, which is an Ayurvedic herb, which is another also very sort of strongly antibacterial, antifungal. So there are different protocols, and actually, if you look at the studies, they're sort of comparable with antibiotic treatment, unless you've got very severe methane infection, in which case you do need to have antibiotics, really, for those. So there's sort of more extreme ones I would consider that, but mostly I use the herbal antimicrobials.
That's
And then
helpful.
you kind of do that, you do the low FODMAPs diet, you do the antimicrobial, and then you look at sort of recolonizing the gut with beneficial bacteria. So that's often about then trying to get balance with maybe with food or with probiotics, all those lovely foods, you know, like the kefir and the sauerkraut and the fermented foods. You can start to introduce those at the end as well, trying to get the balance back in.
Yes, and so and to keep your gut healthy, if you're a healthy person, to keep it healthy, you recommend fermented foods, and this is what the gut biome story is a little bit about, isn't it? Really, to keep all that and to understand that. There's other things that people talk about is eating the colours of the rainbow.
Yeah, I was just going to say that. Yeah.
Okay, yeah, fine. Tell us about that then.
Yeah, so I think that's a good way of doing it, isn't it? Because it's just about, it's really the healthy gut. It's all about having a variety of vegetables. So it's really like trying to have as many different types of vegetables as possible. So that's why I think the rainbow idea is easier, because then, you know, you're just thinking about incorporating lots of different colors. And so it's all about variety. And then, and then exactly. So kefir. And if people can't have dairy, you can get like a water kefir, which you can use coconut milk or coconut water. So that's another option. And then sauerkraut or kimchi. And it's really about having little and often. So you're better off having a small amount every day and mixing it up. So having different ones, really. Yeah, and then, I mean, the other thing that affects the microbiome a massive amount is stress, which it's always back to sort of trying to reduce stress, and exercise can be beneficial. And actually being outside in nature, there's some really interesting studies showing, you know, like gardening increases your microbiome, you know, diversity, just actually getting outside and gardening and things. So,
have you read the book, The Gardened Mind? Have you read that?
No, I haven't. No,
that's a brilliant book. I was actually just given it for my last birthday, actually, and it's written by The Garden Mind. I'm struggling to remember the authoress's name, but she's a psychiatrist.
Yeah.
It is in my group on the, no, I don't think it is on my book list on this group. It's in a different group. I've got it, but it's The Garden Mind. Sue someone, and she was married to a gardener.
Okay.
You know, and together they've created a garden over the years, but she's been really interested as a psychiatrist in the benefits of gardening and how that really helps. And I haven't actually finished the book, but, you know, she talks about prisoners and learning to nurture things and learning to see things that grow and learning that actually these plants don't fight back at you, you know. So really, really interesting how new neural pathways are made through gardening. So interesting book for you.
I think it's also, you know, it's just the reducing cortisol, isn't it? I think often there's some really interesting studies about being in nature and how it just reduces cortisol in the body, and obviously that's very beneficial.
Yeah, no, that's really helpful. So Sally, we're going to be wrapping up soon, but I just wanted you to tell us and tell the group really a little bit about your next project and what you've got up your sleeve for the benefit of us women who want to benefit from some of your herbs. So tell us a little bit about that.
Basically, I suppose over the years I've used a lot of herbal teas in my practice. So mainly because I think that, we were talking before, it kind of is a nice ritual, like you make a cup of tea, you sit down. And also some of the herbs obviously, you know, taste nice and make a really enjoyable drink. So I've used a lot in my practice, and there's been particular formulas that I've developed over time, like particularly the sleep ones and the gut healing ones, and the women, the cooling tea for menopause. So, and I've always had them as a loose tea, but I've known for a long time that they're not very practical. So I've been trying to develop them into tea bags, which I've finally done and got them ready to be able to sell over the counter. And, you know, the fact that, you know, it's more accessible at last. So it's taken a long time to get there, but I'm really excited. And we're going to have some more coming into the range. So at the moment we've got, I'm basically developing a women's range, which at the moment has a cooling tea in, which has got lovely herbs like tulsi and schisandra berries, which, and sage, peppermint for cooling. And then we've got the gut healing tea, which is marshmallow, lemon balm, chamomile, fennel, And then we've got a chest relief, and which is really my cough tea that I've used for a long time. A sleep tea called Nightcap, a relaxing tea. And
it's about the sleep tea, because we were talking about sleep last week, and sleep is a big issue for menopausal women. What do you have in your sleep tea?
So the sleep tea, it's really nice, simple. And again, that's very influenced by my time in France, I think, because lime flower is the main herb in there, but that's also used a lot in Germany. I know it's a really popular herb, but I remember when I lived in France, you could buy these big bags of lime flower at the market, and it's very much part of the culture there. People drink it before they go to bed. It's a really and it tastes so delicious. So it's a very nice relaxing herb. So we've got lime flower, oat straw, passion flower, which is a bit of a stronger relaxant, and then lavender. So it's a nice gentle mix, but it's and then we've got a relaxing tea, and then a defense tea, which is more really herbs for the immune system, like echinacea, elderberry, thyme, and ginger. So that one's kind of more warming, immune tonic, really. And then in terms of the women's range, I'm looking at developing another one which will be more for sort of PMT and a pregnancy tea as well. At the moment, they're just coming. So the women's range, I'm just going to try and expand a bit more, because obviously that's the area that I use most. So yeah, so it's really exciting, and we've been
great. And I think that's really wonderful, because a lot of these things need to be accessible. And I mean, I'm a great believer that we need to know that the quality is there, and it's come from somebody who's got some experience and got some knowledge behind it. And that I think is really helpful to know that. So you're going to go nationwide. You're going to go international. You're going to go.
Yes, so that is the plan. Hopefully, that now we've got the first bit done. We've had some issues, obviously, like everybody with COVID. We've had staff short. We've just had our main person off self-isolating at the moment. It's a constant battle with staff. But as soon as we're back to full team, then that's our plan, is to get it into clinics and health food shops and practitioners as well that would like to stock it. So I think it would be nice for sort of nutritionists, or I mean, we're obviously looking at working with a lot of different collaborations with providing in different areas. So and yeah, that's right. And I've based it really, the majority of the herbs in there are organic and medicinal grade. They're all medicinal grade. There's a couple of herbs I couldn't source organic, so 2 of the teas are not 100%, but the rest of it is all organic, and that was important to me as well.
That's really good to hear, because we do know that the contaminants and things can be really an issue for some people. Well, Sally, that's been really, really helpful. Thank you. I think you'll have helped a lot of us. You've certainly helped me. And just talking to you is really interesting and fascinating, where these things are developing and how quickly they're developing, and how important it is to have this broad view of our health. Not just, and it's not for somebody else to do. We can do a lot for ourselves.
I think that's it.
So thank you so much for that. And anything else you'd like to add before we?
No, I will send you the link for that study, and then should I send you the link for our website as well?
Yes, that would be helpful. I'll put that in the group so we can see where we're going with that, and we can follow you and see how you get on. That's brilliant. Thank you so much, Sally. That's been absolutely great. Thank you so much.
Bye. Take care.
Bye.